Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Bring another really awesome guest today, involved in creating a better tomorrow for many people out there. On the show today, we have the honor of being joined by Doug Leech. He is a founder and chief executive officer of Ascension Recovery Services. They are an organization that's focused on developing and managing comprehensive, fully integrative behavioral health systems focused on treating substance use disorder, as well as the co-occurring mental illnesses across the full continuum of care in the space. Doug has a bachelor's degree in accounting from Penn State, went on to work at Ernst Young in Pittsburgh before returning to Morgantown, West Virginia, and founding Ascension. And through his own struggles with addiction and subsequent recovery, he has developed a real intense passion for helping those suffering from diseases of addiction, and also set out to increase access to substance use disorder treatment across not just West Virginia, but the entire United States. Doug has built Ascension into a national leader for developing these comprehensive systems that ultimately provide the highest quality clinical care in sustainable business models. He also, early on founded an organization called West Virginia Sober Living, which was now a self-sustaining 501(c)(3) nonprofit focused on operating recovery residences, as well as offering job creation and reintegration programming, as well as a network of peer recovery coaches providing a broad community support, very important in the whole substance use disorder space. A lot of really cool topics to get into today. Honored to have him with us. Doug Leech, thank you so much for taking time to come on the show today.
Thank you so much for having me. I'm really looking forward to this.
Yeah, I'm looking forward to getting in a lot of these topics that we don't normally touch on, but really excited about it. But Doug, I'd really like to start things off with you because, your story, your background story to all this is extremely pertinent and important to why you even started down this path. Take us back a little bit and talk, because you speak publicly about your own addiction, but love to hear the background story to how this all got going.
Absolutely. And, I try to take every opportunity I can to speak and, on this topic. And every time I like to share my story. And, it's not every single time that I do that I get feedback or I hear from somebody that it helped them, but it has happened. And I know that me getting that message out there, someone might hear that and it might give them hope. So for me, it's doing things like this are part of my mission. It's normalizing addiction, making it something that we can talk about. The secrets kill us. So I like to talk about it. I like to help break the stigma. And I think every time we have somebody talking about, getting into recovery and, how they overcame those barriers, I think we're making a step forward. So I grew up in Morgantown, West Virginia, and then went to Penn State for college. And I was a good kid through high school, never really got into trouble. Went to Penn State, and really some of the underlying issues that I had, which were, mental health disorders, really became prevalent and just kind of, I didn't even know that they were there. But I started to realize, my anxiety was through the roof, and I could point to different times in my life where I realized, man, I've always worried about something. I've always worried. And I just remember being in class at Penn State and thinking about that. And I couldn't remember a time in my life where I wasn't, terrified about something. There was always something that was kind of looming over me that I was very, very concerned about, none of which were, any type of a real threat to me, so it was in my head. But how it showed up at Penn State is I would have anxiety going to class. I'd have to sit by the door, the chair, the seat right beside the door in case I needed to get out. As I've told my story, family members, have said, "Oh, I remember that time. That's when you were really hard into drugs." And it's like, I wasn't. I wasn't doing drugs then. It's that, and it's funny, but I had mental health struggles, and so terrible anxiety, crippling anxiety. I'd walk to class and I'd get there at the door and I'd turn around and I'd go back. Then I'd be afraid to go into the house that I lived at, just weird stuff. And I was afraid of what people might think of me or how they were going to judge me or were they watching me? Was I sweating? Was I, just all this stuff. And I kept it bottled up inside. So growing up in West Virginia and southwestern PA and that area, I mean, we just didn't talk about feelings. We didn't talk about if someone went to a therapist, the whole community would talk about him for, decades. Now I'm exaggerating a little bit, but you get what I'm saying. It was very much, we don't talk about that. We're tough and we kind of power through. So, when I was in college, I had drank in high school, smoked weed a couple times, but it was really not that, big part of my life. When I was in college, all this anxiety and then the depression was just getting to be too much, and I would drink and I would feel relief. I felt like, oh, okay, I can breathe, I can relax, and I did, and so it worked for me for a while. So I would drink, Friday night, Saturday night, not both nights necessarily during the weekend, but I would have that release and reprieve from all of the kind of the just repetitive thoughts in my head. So I really liked it. Now, whenever I drank, I can look back to some of the first times as a freshman at Penn State. I drank alcoholically. I didn't drink for whatever reason normal folks drink for. I was drinking because I wanted to numb that out. And so it was drink and drink quick, and it doesn't matter what I'm drinking. And I wanted to quiet all that noise and feel comfortable. Um, you know, I share that with people, and people knew me in high school, grade school, elementary, since I was a little kid, all the way through my life. And it's hard for people to imagine. I was
Mm.
always life of the party, and very fun and outgoing and had a lot of friends. And but inside I was just white knuckling it. So started to drink. It became a problem. I would drink a lot and then get arrested or do something, and I would totally embarrass myself, or I'd hurt somebody's feelings by saying something, pretty egregious to them. So I was doing a lot of damage, and I could only drink, periodically, because if I drank all the time, there'd just be a wreckage of, trail behind me. So, through college, I can look back and say, or see how my addiction progressed. And so as a freshman, I would drink, one or two nights a week, then moving up to two, 3 nights, 4 or 5 nights, I would always be able to look at that and say, I don't have a problem because,
Mhm.
everybody else is doing this. My friends are, we're in our 20s, everybody drinks. And I'd also go a week or 2 weeks without drinking anything. But when I drank to get drunk. And during college, I had an injury, broken nose, was prescribed pain meds, and that was really my aha moment. And it was really like, this is what I've really been looking for my whole life. So had the broken nose, painful. The broken nose came from a fight when I was in complete blackout from being drunk. And once I got prescribed those pain meds and I took the first couple, it was the same sort of a relief I had from alcohol, but better. And I wasn't out causing damage. I took it and I just kind of relaxed and watched TV, and so to me, that was the solution. It didn't pop up again until the pills as a big problem, because I had limited access to them in college. But that's kind of my history, and it was underlying depression and anxiety, finding drugs and alcohol, and it really gave me relief. And to me, that was the solution. I didn't know about another solution. I didn't know about AA. I didn't know about treatment. It wasn't something that we talked about. So, I had I graduated from Penn State and went to work at EY. It was Ernst and Young at the time, and started out and was just dedicated to work. Worked really hard. Was but I would drink, embarrass myself, and then I would not drink for 30 days, and after a couple, maybe 3, 4 years at EY, I, met the people that had access to Percocets, OxyContin, all the, prescribed opioids that were out there. And they had as many as you could afford at, kind of at all times. So I found that connection and I had money, not a lot, but I was earning a paycheck. And the two of those was the perfect storm. And when those two came together, access and the funds to buy them, my life just started a very, very fast spiral downward.
And could you talk about sort of the other side of that? Because prior to Ascension, you went on your own recovery journey, and this ultimately is what inspired you to help everybody else. Could you talk about where you
Yeah,
found success in recovery?
absolutely. So yeah, that was my downfall, and it took me down in probably a 2.5 year period of time. I went from being employed to, I left EY. I went to another CPA firm in Pittsburgh. I was there for about 13 months. I didn't really accomplish any work. I somehow got a promotion while I was there, but I was just the biggest, bullshitter that existed. And I had to be, because if I told everybody what was real, hey, in the morning I wake up, I take pain pills all day long, and if I don't have them, I leave work and go, people would just freak out. I'd get terminated. My family would intervene. So you got to keep it a secret. So I became just a professional liar, to keep my addiction alive. So I crashed and burned, was arrested in April 1st of 2021. I hadn't worked in probably 18 months, and had no place to live. I'd disappear for months on end, was sleeping on people's couches, had homeless, and would just show up at a cousin's house and stay there for a while and just kind of squatting at different places. But I went out in downtown Morgantown, got arrested, was in jail, and that's when my dad came down and visited me in jail and said, you've got a really big problem, and if you're willing, I'll get you out of jail, pay your bond, and I'll send you to treatment. And I said, that sounds great. The getting out of jail part is awesome. I'm on board. Don't need the treatment. Thank you for your concern. I'm fine. And it's just I couldn't admit it. He was like, well, come on, and telling me what everybody knew. And it's funny, in recovery, I've heard so many times that, addiction or alcoholism is the best kept secret that everybody knows. And so I thought, if I don't admit it, it's not real. And I couldn't admit it. So here I am in jail, felony charges, not going anywhere, name in the paper, all that type of stuff. And to me, the worst thing would be admitting that I have a drug or alcohol problem. So my dad, he said, that's really disappointing. I'm very sorry to hear that. He was pretty emotionally torn up. I only found out later how badly he was hurt, but he left. And then I'm like, back in jail and wondering what I'm going to do. He came back 2 weeks later and offered again and said, hey, this is your last shot. If you want to go to treatment, I'm willing to get you out. And I said, I'll go. Um, and I said I'd go because I just wanted out of jail. I figured I'll figure it out once I get out of here. So I left with him, and we got in the car. It was my grandfather, a family friend of ours. His name's Bernie. My dad and I, we drove to the airport. We were getting on a plane, and I'm like, where are we going? And I had no idea why we were driving, airport, plane. We flew for a couple hours. They didn't tell me where we were going, but we went to Minnesota, and I'm like, okay, why are we here? They just want me away from them. I'm resentful, fine, you want to get me help, but you want me halfway across the country. But I learned why that was that I went to Minnesota. And the answer was they had tried to get me in treatment in West Virginia or a surrounding state so they could be there to visit me, check on me, just but there was nothing. And so in West Virginia at the time, we had about two treatment centers, residential. They had 16 beds. This is before something called the SUD 1115 waiver was passed.
Okay.
So if you accepted Medicaid in West Virginia, you could only have a max of 16 beds. And I
Okay.
can, dig into that later. But at the Medicaid rates as low as they are, and also of note, they're still the same rate today as they were back then. Whenever
Mm,
I needed to go to treatment, they haven't changed. They have not gone up. Imagine trying to provide treatment and 10 years, 15 years later, the reimbursement rates are the exact same and all other costs go up. So anyway, I realized why I went to Minnesota, and that's because there was no availability in West Virginia. I mean, just so limited resources. So I was one of the few, very, very few, that had a family that was able to pay for me to go to treatment out of state.
hmm
And that represents like 1/100% of West Virginians. And so, now we have a lot more resources in the state, but we had none back then. So I went to Hazelden, Center City, Minnesota. Just
Sure.
um, had a wonderful experience there. My experience, people say, "Oh, Hazelden." So was it like kind of, I think they imagined it as the Four Seasons Maui, and it's like, now this is in Center City, Minnesota. I had three other roommates. The bedspreads were from 1970 something. And this place was phenomenal because of the care they provided, the therapists, their treatment model, the way they went about it. They made me feel comfortable and loved from the moment I walked in the door. I was never shamed, and so that the care was phenomenal. I left there and I moved to St. Paul, Minnesota, and went to a
hmm
halfway house. I stayed there for about 4.5 months, then went to sober living. After that, I returned back to Morgantown, and so my exposure to treatment. And I remember, being in there. I saw the 12 steps on the wall, and I'm
Yep.
like, okay, well, what are these? And like, it's so funny. I knew nothing about that. I didn't know about, what the 12 steps were. The only exposure I had, you might get a chuckle out of this, but when I was in Pittsburgh to kind of bridge the gap when I didn't have money to buy Oxycontin, I would go buy Suboxone. So and so there was doctors in Pittsburgh, and you went in, there was a big waiting room in line. You had your $300 cash ready. You went in, handed the doctor, and he gave you a prescription of, like 600, Suboxone. So,
Yeah.
so I was doing that, and this doc, after going to him, maybe my third visit, he said something. He said, "No, you seem like you're kind of a bright guy, and like maybe you could have something going." I'm like, "Well, of course, I work at EY and all." And anyway, he said, like, this is not going to work for you. And I remember, I don't know why he did this. The guy was, very, very crooked, but he said, you ought to really try going, if you really want to stop, doing these pills, you need to go to an AA meeting. And he handed me an AA schedule. It had
Mm.
all the meetings in this area of Pittsburgh. And I got that thing and said, "Oh, thanks." And remember, I went back to the apartment that I was staying at and laughed my ass off at this thing. My friends and I, we looked at this schedule and just said, "How is going and sitting in a circle talking about our feelings going to do anything?" And we laughed. I put it on my refrigerator. It was, it was just such a joke to me. And meanwhile, I'm dying on the inside. So whenever I was in Minnesota, my experience was addiction recovery was normalized. If I went to a Caribou Coffee shop on Grand Street in St. Paul, I would see four or five other people with an AA Big Book sitting there
Mm.
with their sponsors openly, and it's like these books, like I didn't want anybody, to see that I had one. So the recovery community there was just amazing. There was so
hmm
much treatment in Minnesota. There were so many people in recovery homes. Almost everywhere I went, you ran into people that you saw at the meetings, and it was just a remarkable experience. And when I came back to West Virginia from my time in Minnesota, I was expecting to plug into a similar recovery community, and there was none, just absolutely nothing.
hmm and
So
please.
oh, well, I mean I was shocked. I couldn't believe it. And so I wanted to get plugged into the recovery community, get a sponsor. I wanted to know where, kind of men in recovery were at. Was there a treatment center? Could I go share my story? I had a year sober, like, pick up guys and for me to sponsor. And There really wasn't much. And so I got back into public accounting, but really that set off my mission in my, really kind of my life's work which is to expand access to care. And I wanted to expand access to care in Morgantown, West Virginia. I wanted other
Hmm.
people that did not have a family that could afford to send them to treatment out of state. I wanted them to have that experience that I had in Minnesota there in West Virginia. And
Hmm.
I'll tell you, it's so I was a fighter. I mean, to make it through addiction is arguably, in my opinion, the hardest thing that can be done. I mean, it's terribly hard. And most people don't make it, and so it's very, very challenging. And so I got through that and I thought there's nobody going to stop me from anything. I'll be able to accomplish whatever I set out to do. And so I said I was going to open up a men's recovery home, and that was Morgantown Sober Living at the time, which is now West Virginia
Hmm.
Sober Living. Whenever I opened up this program, I was getting ready to talk to people all around, the town of Morgantown. Everybody told me it's not going to work. We don't have residential treatment. People go to residential treatment just like you did, Doug. And after that, they go to sober living house or a recovery house. But we don't have detox and we don't have residential treatment. Therefore, you're not going to be able to get anybody in. And I said,
Hmm.
I disagree. I'm doing it, and then I started having some of these meetings and I was in like a community forum and meeting with some of the leaders in Morgantown, just business leaders, and they basically told me it's not going to work, don't do it, and I remember at that meeting saying, guys, you misunderstood. Like, I'm not asking for your permission to do this. I'm not asking you if you think it'll work or not. I'm telling you I'm doing it. And I want to figure out if you want to participate and assist, whether it's providing a job for people that come through my program, whether it's, physician practice and you want to provide primary care and physical health, services to my folks. If you want to donate to the program, that's what I'm looking for, not your opinion on if it'll work or not. So
Hmm.
yeah, so that program I opened that was the first program. It was a men's sober living home in downtown Morgantown. I was sued by 8 people when I opened that program. They tried to prevent me from opening. They said that we were going to kidnap children. We were going to spread disease in the community. They said we were going to be an incubator for criminal activity, and we were going to produce, criminals. We were going to. It was going to be. I remember the word. It's going to be a honeypot. So all the drug dealers were going to line up around this house. They know right where to go. And it's like I just kept telling people like. You just don't understand. I mean, this is a place where people are not drinking and are not doing drugs. And they fought it, fought it, fought it, fought it, fought it. I was sued. It delayed the opening about a year. And they really tried whatever they could do to put me out of business, and they did not succeed. And I persevered and I got it open. So it's actually September 11th of 2013 is the day that I opened the home. That's kind of an ominous day. And I remember I was working so hard to get the program open. And I had people calling me. I did an article in the news a couple weeks before and said, I'm getting ready to open. I'm furnishing the house. I'm painting. I'm doing all these things. And this is my number if you want to come. And I put my cell phone number right there in the paper.
Hmm.
And I'll have to tell you about this guy, Joe Mitro, that called me from treatment. He called me every single day about getting in. So anyway, leading up to the opening, I was working. I worked till about midnight, and I got done. And I sent a text message to Joe, and I said, "Come tomorrow morning. I'm going to be ready to be open." So I thought, don't open on the 11th, maybe open the 12th, but I wasn't going to wait another day to get that thing open because I knew it was going to change lives, and that's what I did.
Yeah. No, yeah, again, that's such an awesome story, and the story of perseverance, and I applaud you just for that alone. And obviously, what happens, and your prior experience in West Virginia sober living leads into what you ultimately form with Ascension. And Doug, you've been using a lot of terms, and these. I know, and I sort of prepping for our discussion today. I was sort of reading a little bit about the American Society of Addiction Medicine and these various levels of care. You've talked about a couple of them here when you were mentioning residential treatments and sort of recovery residences. Could you take a little time just to sort of educate the audience for those that may be less familiar? Because we normally think, oh yeah, they're in recovery, like it's one thing, but no, you got this everything from detox to the residential to the partial hospitalization and so on and so forth. Talk a little about the sort of the ecosystem here, because it's much more complex than just one thing, and you as Ascension are involved in managing all of these different
Yeah,
aspects of the recovery process.
that great point, and I will do that. And to your point, I had no idea about the ASAM criteria when I got started. I knew about the levels of care that I went through, but that's about it. And so I opened up recovery housing because that was on the tail end. That is really peer-driven support. I didn't have to be a counselor. I didn't have to be a doctor. This is people in recovery helping people in recovery. So that's what I chose to open up first. And then I networked with other pieces and parts of that continuum of care. So, hey, send me your folks, once they come through. So the continuum, and my dream was always to have a full continuum of care so that people could come into a recovery ecosystem similar to what I did at St. Paul, Minnesota, and Minnesota, in general. They had everything there. And so the ASAM continuum of care really starts with, kind of an inpatient hospitalization. You're really on a hospital floor and you're getting high acuity medical care. You have mental health disorders that are really preventing you from participating in treatment. I mean, you really need this high level of care.
Mm-hmm.
And these you hear as psych hospitals and things like that.
Right.
The next step is ASAM 3.7, and that is what we call detox. This is, what people know as you go to a center and you dry out, or you're really dealing with withdrawals at that period of time. So ASAM 3.7 is the detox portion. That's typically anywhere from 3 to 7 days. Unfortunately, in our country, that's dictated by insurance and what they'll pay for, not necessarily what you actually need.
Right.
Um, but people come in to the ASAM 3.7 and they're there first 3 to 5 to 7 days. Really, what that looks like is comfort meds. We're not giving them narcotics or anything like that, but you start someone if they're heroin, opioids, fentanyl. Fentanyl is the drug of choice most often now. I mean, as we do intakes, what's your drug of choice? What are you detoxing from? Fentanyl, fentanyl, fentanyl. But it's Suboxone you get started on, and it helps you taper down from the heroin. It just so it's not like right off a cliff and you're done, and it just
Right.
eases those withdrawal symptoms and it makes it manageable. Otherwise it's too much for people to continue. So we're trying to make someone feel comfortable at the point at which they're able to. They're not going to be feeling great, but they're able to participate in group therapy, evening lectures, walk to dining, do all those things. We step them down from detox to ASAM 3.5, which is residential, care. That
Right.
residential care at ASAM 3.5 is really the 28-day treatment that we know from the movies and all that
Sure.
type of stuff. And that's where you're done with the detox portion. You're always going to have they call it post-acute withdrawal symptoms, and that can last 6 months, depending on the drug you're on, where you're just not feeling right. But really, that really harsh, miserable period, we try to get over that during detox. So I tell people this all the time. Everybody wants to know about the stats and the odds of success. And what if someone just goes to detox or residential treatment, they leave? How many make it? How many make it? And 20 years ago, we judged success by going through a program and then abstaining from drugs and alcohol for some period of time. A treatment center would say we have a 95% success rate. Well, everybody has their own criteria. Sometimes it's in their mind, and so those statistics are not. They're just not believable. Still not today, because someone is saying, if you left my residential center, I called them and did follow-up calls at 3 months, 6 months. Did they answer the phone? And you asked them, are they still sober? So what, in theory, that metric for success rate, if someone went through detox and residential care, 3735. Then they just went home, back to their job, back to their family, and they had one beer 5 months later,
Mm.
and then they went right back into AA, got back into, following a program of recovery. Are they successful or are they not successful? So the old kind of way of thinking was they were not, they didn't abstain completely. But now we look at success as someone's engagement in their own recovery program. So someone comes in, are you actively working towards bettering your life? Maybe that means you slipped up and did something, but you're right back on top of it. That's what we call in recovery. So 3735, you're within the four walls of a building.
Okay.
The 37, you're really not doing too much moving around. You're in your room, you go get meds, you watch some TV, probably have a hoodie on, pulled way down low, and you're just not feeling that good. Then you go to the residential side, like I said, 28 days. After that, the options become, from ASAM 4 is that inpatient, very high acuity. 3 is your residential detox and residential treatment, 3735. Then it goes down to the 2.0s, which is partial hospitalization, intensive outpatient programming, and outpatient programming. The PHP or partial hospitalization is, I always thought early on, I mean, it's hospitalization. It's really not. It's you're going to an outpatient building for 5 hours a day, 5 days a week. So they call it
Mhm.
partial because you're in a program, but you go home and things like that. But that's an outpatient level of care. So the two O's are all outpatient. And around the country, we don't see too much PHP. I mean, a lot of programs offer that and you try to keep people in that, but really, I just don't see too much in practice.
Mhm.
People going 5 hours a day, 5 days a week, um, if that's very similar to what you did in residential care. So the intensive outpatient is 3 hours a day, 3 days a week with an individual therapy session, and we do see a lot of people do that. 2 weeks, 4 weeks, sometimes insurance will pay for 8 weeks. I don't typically see people participate in IOP for 8 weeks. It's that
Okay.
intensive outpatient program. If we can get people to leave residential treatment and do 2 to 4 weeks in an IOP, I think that that's very, very good. I think that's a great pathway. It's not one size fits all. Everybody needs something different, but generally speaking, more care is not going to hurt somebody. So I always try to balance, what is someone actually going to do? You look at their scenario. So maybe I think, well, if you want to be successful, go to detox for 5 days, go to residential for 28 days, go to PHP for 4 weeks, then IOP for 8 weeks, then, sober living for 18 months. And, not everybody is going to do that, and not everybody is, able to, depending on circumstances in life and what they have going on. So, we try to meet people where they're at and get them to do as much as possible. And that mix that I find is really, do the detox and res portion, 3735. And if we keep you there for 25 days, I think that's a big win. My
Mhm.
goal during that first 25 days is really boils down to ignite a little bit of a flame of hope inside this person,
Good.
give them a little bit of hope, make them feel loved and cared about, and encourage them to continue their recovery journey post leaving the center. I mean, if you can do that in a residential setting, I think you've nailed it. You're not really going to change somebody. So people that tout their statistics and success rates after residential, to me, it's like it's NA. It's not applicable. Like you can't, you know what I mean? Like, and if someone is going to go to residential alone and not do anything after, I say save your money. It's just you're not ready. And now after residential, if you don't want to do one of those outpatient levels of care, PHP or IOP, get a primary therapist, and see them once a week, and go to
Yeah.
AA or NA. And if you do that and you have accountability and you have a support system in recovery, um, you have a really, really good shot at making it. Um,
No, again, I appreciate you walking us through that because it's a topic we haven't touched on as in depth as you just gone. But I wanted again the audience to appreciate sort of the spectrum of activities that Ascension is, oversees in terms of how you set up or how you go about thinking
Yeah.
about setting up these relationships and collaborations. Um, Doug, you mentioned, obviously when in telling your own story about alcohol and opiate addiction, I was telling you before the show about it, my mother and, her issues with benzodiazepines, which was sort of a forgotten addiction that, was the decades prior to having these opioid challenges. And say a lot of people are coming in talking about fentanyl. Any other sort of themes, let's just say, on the addiction front that we should know about as we get close to 2026, maybe combinations, other sort of
Oh
designer
yeah.
drugs, anything you're seeing that, well, I don't read much about that in the news, but we should know about it.
Well, there's some really, really big problems that we have as a country, and it's the new wave. It's not talked about that much, but the
No doubt.
kratom craze, and then all these THC derivatives, Delta 8,
Yep.
Delta 9, Delta 10, Delta whatever. And they're always, it kind of goes back to, if you'll remember, 2010-ish and that kind of time frame, the bath salts that we heard about. And,
Oh
I
yeah.
think there was the guy in Miami that ate somebody's face or something like
Yeah.
there was some story and it was bath salts and it was like, oh my gosh, it makes you a zombie. Well, the kratom and the delta whatevers, the THC derivatives are what we see as really, really dangerous right now. And what they do through these various, legislation in the country, the Farm Bill of I'm not sure what year, but allowing these things, hemp derivatives, kratom, you're able to grow these crops. It's natural. It's whatever. But what ends up happening is they take these things and they take whatever the psychoactive chemical is within that leaf,
Yeah.
uh, and then they, in a lab, extract it and make it into this, I mean, just hyper concentrate. Essentially, it'd be like, 3 acres of kratom, plant into a pill, and so the that's what's extremely dangerous. I've often thought, like, do you talk about these things? Because if I talk about them, like, I don't want people to go doing them. I think, it's like I worry
Yeah.
about saying, and it's the old adage of, back in the day, whenever the opioid overdoses really started picking up, and we were just getting very, very familiar with all that, and fentanyl was introduced. If a news story, and you used to see these news stories all the time, and you don't so much now, but they would say on the North Hills of Pittsburgh, in this area, 9 overdoses in the last 35 minutes, and they would show
Yeah.
EMS responding. It's like people would go to those areas to buy their drugs because that's where, the good stuff is, and just kind of in the drug world, things are diluted and they're mixed and cut and all that. So people know clearly it's strong if this is where it is. So sometimes I worry about talking about those things that people are going to go, try it. But at this point, enough people know, and I think it's worth talking about. But with kratom, something called 7-OH, and it is one of these alkaloids and concentrated extracts from the leaf that functions. And what I've read is it's like, 16 times more potent than morphine,
Yeah.
and so now we're seeing at people's intake and coming into treatment, they're saying kratom, so
Yeah.
we are seeing that and people are coming to treatment specifically for that. And I get phone calls from families that say, well, they kind of quit doing heroin and they're just doing natural, they're doing kratom, they're doing THC, and it's like, man, we're starting to see overdoses there. We're seeing it just wreck people's lives and it be extremely addictive very, very quickly, and just as potent and harmful as anything else. So
Yeah.
that's it. On the THC stuff, there's always been dabs and oils and things like that, but now, you buy it at a, convenience store, a gas station. I go into these gas stations and they've got this stuff that's right there. And I just don't think people realize how dangerous it is. There's a kava root, and there's this drink called Feel Free. And at
Yeah. I
most
remember
gas
Kava.
stations, right by the cash register is the blue
And
bottles. It says Feel Free, and you read it, It's
Yeah.
good marketing. I mean, it looks like one of those 5 hour energies drinks, that became popular. And what I've heard about that is like one, and you immediately have withdrawals from the first one you do. And so, and they're so readily available. I mean, I just think we're on the brink of having a big wave. I mean, I know we are, and it's already becoming a problem. But you're starting to see some states get out ahead of it and ban. So, like in Florida, where I live, they've banned all these things. So, and they do crack down. I mean, the smoke shops that are everywhere, that's who sells this stuff. And in Florida, I live right around the Orlando area, and just frequently past those places. I mean, we went from having not very many of them to there's, wherever you're at, you can stand and see five, and now there's DEA and police at these stores very frequently. So they are really, checking up on it down here. So I don't necessarily know. I think there's maybe 7 or 8 states that have banned some of these things. But I think we'll figure that out and as a country and really watch for that stuff. But the trick is they just change one element within the compound and then it's not the same and then they can re-release it. That's what happened with bath salts back then.
Yeah.
They would change some chemical compound and then it was able to get through. So that's what we see now.
Yeah.
So it doesn't really matter, on the treatment continuum, like we're talking, that care continuum really treats all alcohol, all drugs, synthetic, non-synthetic. It's really that's the path.
Yeah.
Um, yeah, and I forgot to say, but the 1.0 part of the continuum is the peer-driven services. So these are not
Mhm.
doctors, nurses. I mean, this is, kind of outside the walls of a building, but a peer recovery coach working with you, and helping you access care or early intervention. Um, yeah, and so after I got the men's recovery home going and operational and building in Morgantown, we got lots of positive press, and we, had the house full, and it took me a while. I mean, it was not a straight line. It was very hard. I did accounting work as a consultant. I couldn't work full time and run this house, so I had to do the accounting as a consultant on nights and weekends, or time during the day that I had. But I needed that job to pay for the bills at the house, to pay utilities, to pay for everything.
Mhm.
So I was working that job and I was also doing drug and alcohol interventions. And I partnered with a guy in St. Paul, Minnesota. So we had an office in St. Paul on West 7th Street. We had an office that was in the first men's recovery home. And we were doing drug and alcohol interventions. And we were taking people from West Virginia out of state and going to treatment. So that's how I started. There were
Mhm.
not treatment options in the state. So I had to send people out. And what I did was I made relationships with other treatment centers, and I would say, we're dealing with West Virginians who don't have commercial insurance. They don't have much money to pay for treatment, but I can send you a ton of people. What will you do for me on pricing? And they would give the people that we sent, they would do, essentially very reduced pricing. And I found a
Okay.
couple nonprofits that would take our folks. So there was a place, and it's still in existence, but it's called The Retreat in Wayzata, Minnesota.
Okay.
A gentleman by the name of John Curtis is the CEO of that center. And going back to 2013, 14, 15, we would put people from West Virginia into that center. And back then they charged roughly $4,000, for the full stay. They were able to do that. I mean, really, they probably spent per patient about 16 or $17,000, and this is just in their, staff and the housing and, all that. But they raised money and they were a nonprofit and they raised millions of dollars a year. So that's how they were able to do that. And we would send people frequently there. I would send people to Hazelden. And then as
Mhm.
times went on, a lot of these treatment centers said, look, we really want commercial insurance. That pays us 28,000 bucks. If we have someone, so we really can't give up a bed,
Mhm.
for $5,000. So I did everything I could to create relationships around the country for them to accept my folks from West Virginia at a very, very cheap rate. Worked on, whatever I could to put together a program for them that I could get them in to treatment. And that was really where my mission, became the recovery housing. And I've got this little bit of an ecosystem here in Morgantown that I'm just kind of, bootstrapping and putting together. But I really need to get into the treatment center development and expand and grow the business inside of West Virginia.
Mm-hmm. Well, one of the areas and that you've been kind of active in recently is the Native American community, and we'll get to the one of the examples of the partnership with the Pawnee Nation in Oklahoma. But before we
Yep.
go there, could you talk a little bit about the Native American and also sort of the Alaska Native communities? Because again, just looking at some of the data here, it's rather shocking in terms of extremely high death rates, overdose death rates among this group compared to any other racial and ethnic group in the country. High overdose rates, exceptional rates of alcohol use disorder. Again, I mean, the statistics are just all off the charts here. And I was wondering if you could talk a little bit about what you see happening in these communities specifically, and a little bit of the sort of the underlying structural issues, obviously historical traumas and under resourcing and all that. And then we'll go into what you're doing in terms of the culturally tailored approaches.
Yep. Yep. And just as a lead into that, I just want to say, like my business that was recovery housing, drug and alcohol interventions, we started working on opening up treatment centers, and really Ascension was formed, and that's how we became. I saw this need for more treatment centers, not just for tribal nations and for Native Americans, but just all around the country. And I saw the demand really in rural America, not necessarily in urban areas. Southern California had plenty of treatment centers then. They've got plenty now. Florida, plenty then, plenty now. So what I did for Ascension is I said we're going to be a group, because I would have people call me and help me open up a treatment center. And what I found, and I was so shocked, is there was no one out there that took you from planning an idea to building a pro forma financial model budget, to getting a facility licensed, accredited by the Joint Commission or CARF, building out a staffing model that's going to be appropriate, negotiating payer rates and getting in network with, contracts with the payers, certified with, Medicare, Medicaid, and eligible to accept their patients, and then opening the doors and then operating that center. And so what I wanted to do with Ascension is just be an engine for cranking out new addiction treatment centers that were going to last and provide very high quality care and be there for years in the future. And in the country, what I saw is you had kind of two groups. You had very caring folks that had a program and they really care about people, but they did not have the financial wherewithal to run that as a business and keep it, sustainable. I saw people that cared about, money and just margin, and that's all we want to do, and they weren't successful either. So the people that really cared and couldn't run the business side of things and wanted to give away all the care for free, then they would struggle, go out of business. We saw the people that only chased money, that didn't work because they weren't focused on patient care, them, going out of business. And really, all along, there's always been the Hazelden's, the Caron treatment centers, Father Martin's, Ashley, and some of these big kind of American staples in the addiction treatment field. But there's been all this other, phases and waves of centers that have come and gone. But so I pulled in on my team people around the country that had expertise, running clinical programming, developing new clinical programming, hiring and building a team. So this is folks that had worked at a big treatment center, system, and they, personally worked on opening up location number 2, 3, 4. So I built this team of entrepreneurs from the behavioral health space, and the business. We started opening up treatment centers. The first one that I opened was Jacob's Ladder in Aurora, West Virginia, and that was actually featured on a Netflix original documentary called Recovery Boys. So next program I did was with WVU. I'm from Morgantown. We did a partnership and opened up what's called the WVU Medicine Center for Hope and Healing. Fast forward to 2019, we were in 25 states. We had programs with hospitals where we opened up centers outside of the walls of the hospitals. We had done turnaround work for large nonprofits, and we were in partnership with the city of Boston to open and create the master plan for the Long Island Recovery Campus, and that's an island in Boston Harbor.
Okay.
And during that process, Mayor Marty Walsh, at the time, he's proudly a recovering alcoholic. While I was up there working, he would take me to AA meetings and but he hired my company. It was a competitive process. It was us on the design of, programmatically what's going to happen on this island, how's it going to work, financial model. Gensler was our architect and design partner. And together we created this master plan. And then COVID hit, which, changed everybody's priorities. But so all along, over the past 10 years, as we've been, growing and opening up centers all over the country, an area, there's actually two that I'm very, very passionate about that are totally underserved, and it's Native Americans and it's veterans. So I've wanted to do something so bad. The problem, as you mentioned, is great. And I noticed that there were no addiction treatment centers on tribal lands. They just really didn't exist. And so forget, what population has a bigger problem than others. We all have it, and there are none of these resources on tribal lands. So that's a recipe for disaster. So I wondered why, why is that? I started to learn, about that, about Native Americans, about rules and regs of tribal lands and trust land and things like that. And they really operate as a sovereign government. And so, a bank won't lend, on tribal lands. It's like if you have a building there, how do you repossess that? You can't. How do you take collateral? You can't. You can't file a lawsuit against a tribe, so there's all of these things. And so I saw, man, well, this is why, it's so challenging. So the need's there. And then I see casinos everywhere, and it's like, casinos, in my opinion, fuel addiction. They fuel and are just kind of hotspots for prostitution, criminal activity and drugs and alcohol. It's just like, now there's people that go to the casino, play the slots or play games and have a good time in Vegas and leave or wherever else. But there's also a lot of people that really struggle and it does a lot of damage. So I saw, as far as business goes, on tribal lands, that's about what you see is, casinos. And so they really had this unmet need for healthcare. I saw IHS, Indian Health Services, doing these, kind of whole person healthcare clinics on tribal lands, and they would hire some of the people from, the tribal nation that they were working with. And but there was really nothing comprehensive for addiction. So I just made up my mind, I'm going to do something about this, and we're going to go after, this area and help get treatment centers on tribal lands. I was met with Baker Tilly. This is in early January of 2021, and they told me about this project that they were working on. They were working with the Pawnee Nation out of Oklahoma to create an addiction treatment center on their tribal lands. They were working with a gentleman named Brian Kirk, and Brian was, he was graduated college in California, came back to Pawnee Nation and started working there with a master's in public health, and he was leading this charge. He got a grant, and four or $500,000 grant, something like that, to explore and research and do feasibility studies and about having an addiction treatment center on tribal lands for the Pawnee Nation. He engaged Baker Tilly, and Baker Tilly was helping him. Their healthcare consulting group, and they were putting together this model. And then they talked to me, and they Baker Tilly did, and saw what we were doing and said, "Hey, we're not getting traction. This thing's kind of stalled. It's we've got a good plan, but really nothing else is happening. Can you take a look at this?" And so I gladly did, and I was just like the perfect opportunity because I really wanted to do something in this space. So I got the plan. I looked at it, and it was exactly what I said. It all came down to we know You can build out a financial model. We know what salaries are. We know what the revenue rates are. If you bill Medicaid, there's some complexity around billing Indian Health Services for, some of these tribal rates, but you know what the rates are. You know what the expenses are. We have a good budget. You can build a facility. That's easy. You hire the construction company, design firm. There's a million of those. So like, why was this thing not taken off? And it came down to money.
Mm,
Um, Came down to money. So, who was going to finance it? Who was going to fund it? And this project at the time was about a $16 million budget. Well, that's
mm,
a big price tag, and you have no idea where it's coming from. So I looked at this and I went through and I worked with the Pawnee Nation, and they had some American Rescue Plan funding that
mm,
was not used. So the ARPA funding they had, and they told me we can allocate about 1.5 million of this ARPA funding to this project. Like, what can you do with that? And my answer was, if you put that up, I'll do the rest. I'll make this happen. And I didn't know how, so I got to work. But what I did was I looked at that money, and then I said, I need to get a bank to lend to this. So I went through and investigated all that, and we got Native American Bank, out of the Southwest, to give us term sheets. There was all these complexities about how do you do this? How does a bank finance with kind of the challenges or restrictions that I mentioned earlier.
sure.
USDA had a program where they would back a loan, the federal government would 80% of the loan. So we pulled in USDA and through Native American Bank with this 80% guaranteed by the federal government loan. We applied for grant funding. We got a $3 million grant. We got a $1 million grant. We got a $250,000 grant. So we had this, 4,250,000 of grant fund. The Pawnee's 1.5. And then I said, I'll put up $2 million. Now I've been successful in this space, but that's a lot of money, and that's about all that I had. But I said, I will put this up and put it in there, to help get this thing going. So now a bank could look at this and say, all right, you've got 1.5 from Pawnee, two from me, that's 3.5. You got the 4.125. I mean, dang near got 50% of the capital stack or more, right there. So now we go get a loan through USDA and their program where it backs 80% of the loan. There was pretty much no risk now, So, and I had, financial advisors, friends, you name it, that said like, you can't do that. Like what happens if you put the money on and then something goes south and, you have no control of the program and you don't get it back. And, for better or for worse, whether maybe I'm stupid, maybe I'm really smart, I don't care. And I wanted to see this thing go. So I did it, So it's really, an unsecured note, but that's what I did to see this thing go. And I believed in the people with the Pawnee Nation. I believed in these folks. I love these folks. I mean, I spent time down there with Brian Kirk, and I bought into his mission. He wanted to see this thing launch. And it was very much the same mission I had back in 2013 when I got that sober house going in Morgantown. I saw Brian's, just his tenacity and, that he was going to fight and make this thing happen one way or the other. So, I think there was a lot of mutual trust that had to be built. You talked about earlier generational trauma. That's a real thing, and it is, probably the most important thing for me on this project was building trust with them and them knowing like I'm somebody that you can trust. And I'm going to show up and I'm going to do what I say that I'm going to do. And I'm going to keep coming back. And, if I'm involved, we're going to make this thing work. Doesn't mean I've been perfect and doesn't mean we haven't had bumps along the way. We certainly have, but I will figure it out, and when I'm in and a partner with somebody on a project, I will fight until we win. So anyway, so we did that. Baker Tilly was very actively involved in working on this capital stack. They helped us with the bank financing. They went and got new market tax credits. New market tax credits are something I know enough about to be dangerous, but not enough to speak eloquently about it. But they got a really large award of new market tax credits that ended up providing, essentially like a net cash benefit to the program of about $2.5 million. So we pretty much had the building paid for. There's a couple other grants that are out there, and if we get those grants, and we still might, essentially the program has now been put together, the banknote can get paid off, and the building sits. So because that's the other thing, and I forgot to say that there's all these federal funds that are available, but no one knows
Sure.
what to do with them. It's like this, each president comes in and they put more in this bucket, but there's nobody that knows how to put this together and make it work. And I
Hmm.
think it takes somebody doing a showing of good faith and, putting money where their mouth is. It's like, I believe in this thing. So yeah, Ascension is a contractor, consulting firm. We get hired to do our work. I mean, everybody lines up and wants to get a contract with hospitals, tribes, you name it, any business and get work. But I was putting my money where my mouth was and said, look, I'm putting up this money. I want to see this thing go. I believe in it. I'm at risk. So anyway, that's how we got that thing going. We worked from planning and 2021 to completing the capital stack in 2022 to
Okay.
where knew what that was. We started construction and we had just some great partners, with us in this, venture and started construction. We completed construction, beginning of this year and we opened up the center. Doors opened in, I think, May. And we opened up the residential side, so the 3.5 side, and then we opened up detox about 30 days later. So, um, anyway, that I think I mean that's a good outline of how we got that thing going, why
Hmm.
it's so challenging to get it going, all the hurdles and just challenges and risk and just you don't know and people getting involved in a project and then they leave the company that they're with and then it kind of falls apart or they lose interest or whatever else. And I think it was a group of people, Thompson Construction, Baker Tilly, Native American Bank, USDA, the EDA, Pawnee Nation, and Ascension Recovery Services. And, we all got in there, stuck together, and went through that, and yeah, so I'm so proud of that project. It's a beautiful facility. It's changing lives. It's on their tribal lands. One of the things I'm
Yep.
most proud of is this is an asset that is theirs, and that when the new market tax credits, sunset and over this 7-year period, they'll own this thing,
Hmm.
and further, there's jobs being created on these tribal lands. And, for us, we're restoring lives, and it's not just for Pawnee Nation, it's anybody in the region. So
Yep.
we have folks from there, from other tribes. We do contracts with other tribes so they can come and go to treatment here. The only thing I'll say that we need is more. We need more. But it's doing so much good. And really, as I look at it, our challenge is, and or really what our objective and our goal is over the next 5 years is building that workforce so that it can continue without us and not be reliant on us long term. We want to get in, help the program get going, but I don't want it to be dependent on me long term. That's kind of anti, good business, I suppose. We want recurring revenue, and a lot of times you're looking at how do I, kind of get my hooks in and keep this thing for as long as possible. But I don't want that. I want this thing to be the Pawnee Nations. I'll help them as long as they need it, of course, but I want to grow their workforce, teach people, help folks go further their education and become licensed clinical social workers, counselors, therapists, peer recovery coaches, and work at the center. And
Hmm.
then you mentioned the cultural competencies. I mean, that's something that, very early on, I mean, I know that I know how to put together a business model and launch a program, and but as far as all of the nuance and, essentially to be and provide culturally competent care for the Pawnee Nation, I'm not going to be able to do that. So I pull in very, very trusted resources and advisors to assist with that part of the program. There is some good curriculum that's out there, White Bison, things like that that you might have heard of.
Yep.
But early on in this project, we pulled together and pulled in JBS International. And JBS International is another consulting firm. It's a nonprofit based out of DC. And a lady from West Virginia, Kim Walsh, works at JBS International, and I knew her from West Virginia. She was involved in substance use disorder treatment in the state. I was, growing up, so we knew each other. She's, since went on to JBS, and I reached out to them because they have really a department within their company that does consulting to tribal nations around the country. So I pulled them in and said, sit alongside me and help me with this component. So anyway, I could go into more detail, but that's, when it comes to building a program, I know that it's very, very important. I know that these traditional healing practices work, and I know that they're very, very important to people like the Pawnee Nation. And we have those integrated in. We've got some grant funds to build, and we're working on it right now, a sweat lodge.
Yep.
So you mix modern medicine and kind of these traditional evidence-based practices with their traditional healing practices, and you have a remarkable program. But this
Yeah.
is a program that, if I were looking to go to treatment, and I knew about this back whenever I needed it and went through it, this is a place I would choose, if I had that option, because it's
Yeah.
such a great program.
Yeah, I looked at pictures of the opening and the ceremonies and all that, and it's a beautiful facility. It's and again, a testament to what you're capable of putting together, and obviously the veracity of taking the time to figure out how to get this funded as you did. So I mean, it's again another hats off to you for making this happen the way you did. And again, the traditional healing practices, I'm a big fan of that. And as you were mentioning, the sweat lodges and talking circles and storytelling and all the other interesting. I was reading about something called the walking in two worlds model. It's all really, really spiritual, really cool stuff. So it's
Yep.
impressive from that angle too. Um, Going to sort of the, I mean, I'm a huge fan of, like, again, learning from history, learning from nature, and these different approaches. But we're also in a very interesting time, as you pointed out, with the problematic substances that are out there and the ability of chemists or whatever to modify drugs and make them, take them, something that's illegal, not illegal anymore, and all that. When it comes to sort of the other side of that equation, I mean, obviously a lot happening in the pharmacological domain in terms of new interventions, everything from the sort of the AI space, neuromodulation, all this other high tech stuff. Are things sort of on the horizon that get you excited in terms of sort of the next generation of methodologies? Obviously, what you're doing is awesome, but what's
Yep.
coming down the pike that excites you, that or make for good synergies potentially in these integrated ecosystems you're building?
Yeah, it's a great question. And just real quick, see the blanket there? That's my Pawnee Nation blanket that
Yep.
they gave me at the grand opening ceremony, and it's
Very
one of the most
cool.
special things that I have that I've ever received in this business or just life in general. But yeah, so I am always, we're still at the infancy of this kind of field of medicine and
Yeah.
healing and just, really understanding. It's we've come a long way, but there's still so much more to do, and so we got a long way to go. So there is new stuff, and it'll be. I remember, 10 years ago it was CBD, and CBD, the hemp derivative we talked about before, like this is going to be kind of a cure-all and everything. I remember some people were thinking about that. Then you see things like, hallucinogenics and,
Yeah.
kind of going to Costa Rica and taking ayahuasca tea or,
Yeah.
whatever. And, you see these things. I mean, I think there's something to be said for some of these new therapies that involve ketamine. It's like, for me, I stay very skeptical and kind of watch as it evolves. But, some of these things may or may not, be helpful. I think that's one that could be for someone that has severe trauma and unresolved, some of those therapies. It's again, it's something that I'm doing, more research on before I would, kind of say this is, a good thing or not. But, as far as technology and AI and all of that world of predicting relapse and analyzing human behaviors through the use of AI and technology, there's something there. So I'm just blessed to be from Morgantown, West Virginia, which is the home of WVU Medicine. Within WVU Medicine is the Rockefeller Neuroscience Institute, and it's led by Dr. Ali Rezai. And this is a world-class doctor, and in the neuroscience space, and specifically on brain disorders and addiction and Alzheimer's and Parkinson's and
Hmm.
things like that. But he is a guy that he's one of these guys that is a once a generation, type person and just thinks on another kind of a different level. He's created some technology, some first in the world stuff, and he's developing that. And so, one thing that he did, there's things like TMS and this kind of brain stimulation, the helmet goes
Yep.
off, it's focused ultrasound and things like that.
Yep.
Well, he's done, and currently they have trials that are going on that are, excuse me, deep brain stimulation through
Hmm.
ultrasound that actually goes past the blood-brain barrier. And I'll mess it up and not do it justice by saying much more than that. But this targeted ultrasound, you go to those receptors and it alters them so that they don't respond to cravings and withdrawals and things like that. The other thing that he's done the first in the world brain surgery and brain implant to essentially cure addiction. Now,
Mm.
Dr. Ali Rezai he's smart enough to know that, this is part of the equation. The other part is you have to work a recovery program. So,
Yep.
to meld those two together. But if you look up online, there was a 60 Minutes piece on this Wall Street Journal front page article about this surgery, and the guy that received this first in the world surgery brain implant for addiction his name's Jared Buckhalter. Jared Buckhalter's from Southwestern PA. I was working very closely with WVU, and I knew they were going to do this surgery. I was talking with Mark Hout and Jim Barry, two docs at WVU that I've worked very closely with and are just phenomenal people and just brilliant whenever it comes to uh, all things addiction and behavioral health. And they
Hmm.
said, we've got this going on. Allie is going to do this first in the world, surgery. We're going to take the guy's head off. We're going to put this, implant in,
Yeah.
and we need recovery support after this. He's going to be in the hospital for weeks. And then after this happens, like recovery housing or whatever. And so what I did was I said to them, what we can do is give him a job, and you'd mentioned earlier, and I think it's such a great topic, but jobs and workforce reintegration for people in
Hmm.
recovery. You go and get sober, go to the best treatment in the world, then you go to the coal fields in West Virginia, and there is no job, no hope. Like you don't have a shot. So you can get clean and sober, but if there is no purpose, no job, you're not going to make it.
Yeah.
Likewise, you go to treatment, you come out, you don't do anything for your recovery, and you go right into work, you're not going to make it. So
Mm.
anyway, so Jared Buckhalter had this procedure. It was successful. It was the first one. Jared was in the hospital for a couple weeks. He came and interviewed with myself and a guy by the name of John Dower, another behavioral healthcare leader in the state of West Virginia, and he's the executive director of West Virginia Sober Living. John and I met with Jared and interviewed him. He was a little delayed in how he was talking, and John are kind of like, oh, wonder if he's ready for this. But we said we're going to give him a job, and we did. And Jared Buckhalter, he got through that normalized, from the procedure. They from at WVU can dial up, dial down, this implant, so it you know it just really how much it impacts or these receptors. So if he's having cravings, if he's having irritability, if he's having depression, they can really adjust that stuff. I mean, it's just absolutely crazy to think about, but they did that. So Jared, he's been sober ever since. Jared has worked for me ever since.
Mm.
This was probably either 2017 or 2018. I think 2018 maybe. But Jared is it's a remarkable story. He's a guy that tried everything else. He had multiple overdoses. And for them to even be able to do this study, I mean, really the criteria were you have to be more than likely kind of going to die. And
Mm.
so Jared was. And so he did this. But He still has the brain implant. The wires come down through his neck, and he's got a little thing, kind of like a pacemaker in his chest, and goes up. And they, kind of fine tune this thing probably once every 6 months now. It's very infrequent, but I think that if you can match technology with this recovery ecosystem and support system like we did, we wrapped around Jared the job. We wrapped around him. Another good story. Remember, I told you about the guy that called daily from treatment about my
Yep.
sober living house opening? That guy's name is Joe Mitro, and Joe Mitro works for me to this day. He's been
Nice.
sober ever since he came in that day. He spent 35 years addicted to crack and, homeless shelters for 20 years. Joe is still clean, sober. He's just a best friend of mine, and he still works at my company. And we made Jared Joe's executive assistant. So
Nice.
Joe, and really, Jared, you follow Joe around. You help him out. You do what Joe does. And so we've got this workforce that are people in recovery, many of which have come through my programs.
Hmm.
So you talk about technology and promising practices and things that are on the horizon. I mean, that is, something that, I mean, can be a game changer.
Hmm.
Ali Razai is working on, wearable technology now. We're going to go through and do this, essentially partnership with the Rockefeller Neuroscience Institute, and patients that come through my programs in West Virginia called Wise Path Recovery Centers are going to be eligible to go in the trial and work with these folks under Ali's supervision. Some of which will be focused ultrasound, but
Hmm.
also their wearable technologies.
Right.
And but yeah, I'm sure you got questions on that. It's just
No,
what is
it's funny. I'm sitting here. I'm familiar with Doc. I mean, I've reached out to Dr. Razai in the past. Actually, I totally forgot he was from West Virginia. But I got to do that again. I took a peek at my email while you were talking about that. I reached out last in 2024. So yeah, I gotta I gotta do a show on that because that's another really elegant
yeah.
example of technology. But as you're saying, technology great, but unless you can integrate it into the full system of services, you're not going to do as well. So I think that's really important. So that's
When you do that, we'll get Jared Buckhalter to join you as
yeah.
well, and you can talk to Jared. But yeah, he's remarkable. Jared had a baby this year, and I mean, Jared's got a family, and he helps so many people in recovery, and it's really remarkable. I've got a meeting today with a girl, Rachel Blasco, who was an executive at WVU Medicine. I worked with her to open up the
Okay.
Center for Hope and Healing, and then Rachel worked with me at Ascension and WisePath, and then she left recently to go to this technology startup that is some of this technology that we're talking about.
Okay.
So we are going to figure out how do we work together to take the technology that her company, who is very closely related to WVU Medicine and some of the technology and IP that's been created there, and how do we integrate that technology into the treatment centers that we operate. And so Rachel and I will be meeting just this afternoon and talking through this. And so I think it's um, we will continue doing the treatment that we're doing. I'm not an inventor. I know what works, and we do the best practices, but I'm always keeping my eye out for that stuff. We will, I think it's part of my responsibility to allow and to help those folks, and give opportunities to the people that come through treatment if you want to participate,
Yep.
and I think that there's certainly going to be some breakthroughs. I mean,
Absolutely.
I believe it'll come through Ali Razai and that team there in Morgantown, West Virginia at WVU. I mean, that's what I believe.
Awesome. Um, Doug, what else is coming up? I mean, what else? I mean, obviously you got so much going on. What should we be on the lookout for in terms of you and Ascension Recovery Services as we get into 2026? And then anything else I missed that you wanted to talk about?
Yeah,
Whatever
no,
you do
that's
that.
great. So we've got a partnership with a group called Nelson Construction and Development out of Des Moines, Iowa. This group is a phenomenal group of people. They were really, really big in the senior living space and had many facilities, assisted living, all the way to memory care. And they're very calculated and analytical, and they wanted to get into another vertical and they wanted to shift their business, and behavioral health is the space that they wanted to get into.
Hmm.
They went through just a crazy, intense vetting process of me and my company, Ascension Recovery Services. They looked around the country and essentially they said, we want to find the best organization to help us open up a portfolio of programs, new programs that are going to meet unmet need in communities around the country. And so this is an exciting partnership for us. They're opening up 10 detox and residential treatment centers. Basically, they came to us and said, Doug, we're going to line up close to $200 million in capital through debt and
Nice.
equity. We're going to invest it in the behavioral health space. We want to make the biggest impact as possible. Obviously, we want to get our money back, and we believe you can do that, but we want to make a big impact. And I'm like, you got to be kidding me. So I've had phone calls like that. I've had first 2 or 3 meetings where people have these big grand visions, and it's like, man, I've just always wanted something like that, where we can make a big impact. And essentially, they're giving me the canvas and the paint, and they say, make a great picture. And
Hmm.
so that partnership with Nelson Construction and Development has been one of the most exciting for my business, Ascension. Out of this, and I'll also, fast forward, they kept to their word, and they are putting this money in, and I work with them with banks and lenders, and convince them that we know what we're doing, and this model is going to be successful. But really, what they want to do is open up in rural America and open up centers in Iowa, Minnesota, Indiana, North Carolina, in areas where treatment doesn't exist. And they want to treat a Medicaid population, and certainly, Medicaid, but you have to have some commercial insurance and self-pay to balance the
Sure.
model, make it work. Otherwise, it just doesn't. The Medicaid rates are so low. So, this partnership, we have 3 of the first 10 centers open and operational. We have 7 more that we're opening between, over the next 7 months. So we've got 2 more that'll open before the end of the year. We have 3 that'll open in quarter 1, and then another 2 in quarter 2. So we have just a busy, busy time. I've been able to attract and pull in some really, really good talent to help me with this. A guy that I, really idolized, since I got into the space, is a guy named Doug Tiemann. He's the former CEO and president of Care and Treatment Centers. He was CEO
Okay.
for 25 years. But as I got into the space, I just looked up to Hazelden Care and Treatment Centers,
Hmm.
Father Martin's Ashley. These are the programs that really inspired me. And Doug Tiemann is a mentor to me, and someone that is, coaching me and guiding me in my business. This big portfolio with the Nelson group is an opportunity for me to say, this is where we should go, and this is where, what services we should provide. This is the payer mix. This is who we should hire. This is how it should all work together as a system. Of course, me and my, wonderful team of people. So it's a very important project. We have probably, I would say, 15 centers we're opening in 2026, and probably another 15 in 2027. So that's a lot. And, I want to get it right. I want to build these things the best way possible to provide the best care for patients. So anyway, I get to work with a guy, Doug Tiemann, who I've just seen what he did at Care and Treatment Centers, and ran the best treatment center in the world for 25 years. And I get to work with the group, Nelson Construction and Development, who believes in me. They believe in my mission. And they are allowing me to, really fulfill my dreams, which are, treatment in places where there was no treatment. So I'm very, very blessed to have wonderful clients and partners. I'm grateful to have great advisors like Doug Tiemann, another guy who's helped me since I opened up my sober house in Morgantown. His name is Don Bear. He's a PhD psychologist, and has been my best friend and mentor. we're a funny relationship. I'm in my 40s, he's in his 80s, and we are just best friends. And he's coached me and guided me from opening up the sober house. And the first, I had three people in that sober house, and I didn't know what to do. And they're, giving me a hard time, and I'm thinking I made a mistake. And Don Bear would keep my head on straight and tell me and coach me. So I've got really great people around me. The people on my team in Ascension are phenomenal, and I've got really great, mentors and clients like Nelson. So you're going to see us open up a bunch of treatment centers. These centers are remarkable. They're providing the best quality care, and they're treating a population that has nowhere to go right now. So it'll be a very big year for us.
That's it's exciting. I mean, I love hearing growth stories like this, and the fact that you're going to impacting so many lives is just, it adds to the story. But it's extremely impressive. I wish you, Doug, the best with it, you and your team, as you continue to develop this vision and mission. And again, really impressive work. For everybody out there that is going to be listening to this episode across the various podcast networks, or who will be watching on the YouTube channel. Again, you've been spending time listening to Doug Leech, founder, chief executive officer, Ascension Recovery Services, doing really amazing work to develop this comprehensive behavioral health system to treat substance use disorder, as well as all the co-occurring mental illnesses. Doug, I really want to thank you for taking the time out of your schedule to talk to us for a little while today about everything that's been going on. Thank you for everything you do for patients. And as we like to say here on our show, thanks for helping to create a better tomorrow for so many people via what you've developing there. Really very impressive story.
Well, thank you for giving me the opportunity to talk about it. I very much appreciate it. And I'll check in with you late 2026 and let you know how things are going. And if maybe I've burnt out and I've got no hair and but maybe we've been successful. And I happen to think that we will have been very successful. So I'll let you know how that goes. But thank you
Absolutely.
so much for having me. It was a real joy.
Absolutely. It was a great show.